Hi there, my name is CJ Westfall, licensed Medicare specialist with the Medicare Help Center, and I'd like to make this video to send out to my clients and to friends and even family members that are senior citizens that are on Medicare that are wondering today, how should I take precautions? How should I be responding to this? There are folks on both sides of the spectrum. There are folks that are overreacting and buying all the rest of the toilet paper out in Walmart. And then there's the folks who are completely underreacting. And I just like to strike a balance and cut through the media BS here. I'm a licensed Medicare specialist at the MedicareHelpCenter.com. If you're watching this video, please take the time and share this with a family member who is a senior citizen, no matter if they're in South Carolina where I live or any part of the country. Go ahead and share this. This is going to have some critical information from them that is not being reported directly to the mainstream media outlets. First and foremost, the coronavirus or COVID-19 has claimed the lives, as of this recording on March 11th, has claimed 32 lives in the United States, 4,000 across the country, and right now there's 112,000 patients across the world, which doesn't seem bad, but it is spreading at a pretty quick pace. The Center for Disease Control has been kind of taking the lead on this, and they've released a couple of statements yesterday. They had released a statement saying, and this is directly from a senior CDC official. She said, quote, "Have enough household items so that you will be prepared to stay home for a long period of time." Yesterday, I read that medical officials are reporting that the coronavirus is killing seniors 10 times more frequently than its younger victims, especially if they already had an underlying medical condition. So first and foremost, we're getting from government sources, stay home if you can. Health and Human Services Secretary Alex Azar said Saturday that seniors should avoid crowds, especially in poorly ventilated places. Surgeon General Jerome Adams said this weekend, "We want people who are older, people who have medical conditions, to take steps to protect themselves, including avoiding crowded spaces, thinking carefully about whether or not now is the time to get on that cruise ship, or whether or not that now is the time to take that long flight." So this is from the Surgeon General, this is from the CDC, this is from the Secretary of Health and Human Services. They're saying stay home. If you are a senior, stay home. You're more likely to see this virus advance. Now, those of us in South Carolina, I live in South Carolina, the majority of my friends and family are in South Carolina. You need to know this. This part is key. MUSC, which is if you don't live in South Carolina, fantastic hospital and a fantastic place to go to school to learn about health and medicine. MUSC Health is offering free virtual care consultations and screenings to anyone experiencing COVID-19-like symptoms located in South Carolina with the promo code COVID-19. Of course, I'm going to put a link to this here down in the video. This is for both new and existing patients. If you have immediate health concerns and wish to speak to a medical professional, MUSC recommends a virtual care visit to speak with a provider online rather than coming in person. You can also call 843-792-7000. Of course, this will be below. For more information, MUSC virtual care can be accessed by phone, online, or through chats. Here's the next really important subject: does Medicare cover this? I'm on Medicare. I'm on a Medicare Advantage or Medicare Supplement. Am I going to have to pay out of pocket? I'm living on a fixed income. No, as a matter of fact. So Medicare released earlier this week that they're going to cover 100% of the lab tests for COVID-19. You're not going to pay any out-of-pocket costs, no matter what plan you have. Medicare covers all medically necessary hospitalizations. This includes if you're diagnosed with COVID-19 and might otherwise have been discharged from the hospital after an inpatient stay, but instead you need to stay in the hospital under quarantine. So this is saying, folks, if you're going to go to the hospital for this, if you test positive, prepare to stay there for an extended period of time. At this time, there's no vaccine for COVID-19. However, if it does become available, it will be covered under your Part D prescription drug plan. That's good news for seniors. And then also for those of you guys who have the Medicare Advantage plan. I'm not the biggest fan. I help seniors every day save money on their Medicare supplement plans. But if you do have one of those Medicare Advantage plans, you have access to these same benefits Medicare is allowing these plans to waive cost sharing for COVID-19 lab tests. Many plans are also offering additional telehealth benefits beyond the ones that we just described. That's the next thing that I really need to hit here, guys. If you're thinking maybe you're having some kind of flu-like symptoms, or if you're thinking, man, maybe my symptoms are kind of aligning with what I've been hearing from the news, Medicare has actually expanded its telehealth operation. President Trump on Friday, so here we are Wednesday, March 11th. On Friday, President Trump expanded by about $500 million Medicare's telehealth operation. Let me give you just a quick rundown on that so you have an idea. Basically, the way this is going to work is Medicare is, right now, they cover virtual check-ins, so you can connect with your doctor by phone or video, or even an online patient portal to see whether you need to come in for a visit. If you're concerned about an illness or are potentially contagious, this offers you an easy way to remain at home and avoid exposure to others. You may be able to communicate with your doctors or certain other practitioners without necessarily going into the doctor's office for a full visit. Medicare is going to pay for virtual check-ins. On Friday, the legislation that President Trump signed is going to let Medicare expand the use of telemedicine in outbreak areas, potentially reducing infection risks for vulnerable seniors. I'm going to post below this in the details information about the telehealth and telemedicine, so that way if you do feel that you are sick, let's go ahead and try to use that telemedicine or telehealth feature of Medicare so that we're not spreading this virus anymore. But overall, let's put these numbers and quotes from government officials aside. Should you be panicked? Should you be freaking out? I don't think so yet. Like I said, only 32 folks have had their lives claimed, and that's terrible. We shouldn't even have one life claimed by this, but it is the reality. And just now, as I was preparing to make this video, the World Health Organization has upgraded this to a global pandemic, is what they're calling it. I think that seniors should still just stay calm on this. Yes, you are more likely to contract it. Yes, you're more likely to reach fatality as a result of it. But if you stay home, if you wash your hands, if you're taking good care of yourself, you're stocked up on groceries for at least 2 weeks, which is what you should have anyway, then I think we should ride this thing out. Now, of course, this video could age poorly, and by April, the death toll could go from 32 to 32 million overnight. Who knows? But a lot of experts are saying that after the flu season tapers down by April, they're thinking that we're going to start seeing this virus start to cool down. In places like Italy, they've quarantined the entire country. In places like China and South Korea, they've been able to tamp down on this virus pretty well by doing things like closing public events, closing schools, and we've started to see the contagious new cases. We've started to see that close down in some of these places. So do I think this is the end of the world? No. Should you think it's the end of the world? No. Stay calm, stay balanced. Like I said, don't get too freaked out and don't be too underprepared either. We need to find that balance. Now, if you know anybody that is on Medicare, that has a Medicare supplement plan, I work here with the Medicare Help Center. What we do is just save seniors money on the same exact Medicare supplement plans they already have. I've spent the last 5 years as a licensed Medicare specialist, saving seniors thousands of dollars every single day. That's all I do. That's all I specialize in. At the MedicareHelpCenter.com, you can see our certifications, where you can see that I am a licensed Medicare specialist. You can see the MedicareHelpCenter.com is a licensed business here in the state of South Carolina. Even if you don't live in South Carolina, I'm most likely licensed in your state. I'm licensed in many states across the country. If you like my help, or if you'd like to talk more about Medicare, any questions that you might have, anything Medicare related, that's what I do best at. That's what I study the most. That's what I'm up to date on, and I get the news alerts for every day. My phone number will be below. It's 843-605-1031. My name again is CJ. It's 843-605-1031. Remember, be calm, guys. Let's strike a balance. Definitely know the facts. Share this video with family members. And if you feel that you are having some kind of symptoms, link onto that Medicare telehealth, telemedicine feature, so that way we're not spreading it all around the country to our friends and family members. Thank you so much for taking the time to watch this video. Have a blessed rest of your day. Hopefully we move past this as a country. We'll talk to you soon, and look for more videos from the MedicareHelpCenter.com. Bye-bye.